Good afternoon, everyone. Thank you for attending today's webinar, Secure Faxing 101, in order to learn how Biscom's fax solutions help with HIPAA compliance. My name is John Lane, the Chief Information Security Officer here at Biscom. I have over 21 years experience working directly with customers in the healthcare industry to develop solutions that secure and automate the exchange of healthcare information. Before we get started, a couple of housekeeping items. If you have any questions, we encourage you to send them in. Please use the question tab on the GoToMeeting panel to submit them. We're going to do our best at the end to answer all of those questions. If we run out of time, we'll contact you individually with those answers. Additionally, if you encounter any problems, technical difficulties, you can't hear us, you don't see the slides advancing, that kind of stuff, just use that chat feature and let us know. We'll help you take care of that. Today we're going to talk about secure faxing and how it works with healthcare and HIPAA. We're going to talk about the challenges of document delivery within healthcare. We're going to talk about the document types that are transmitted and exchanged between organizations. We're going to talk about those applications that are used with fax and healthcare and document exchange. We're going to look at HIPAA and fax, how the two work together and how there's certain considerations for fax when it comes to HIPAA. We're going to take a look at considerations when choosing a solution and deploying it, what you need to think of ahead of time. And then we're going to talk about Biscom and healthcare, some of the products that we have and what we do with them, as well as some of our experience. One of the biggest challenges healthcare organizations are facing today is dealing with HIPAA and the impacts throughout the organization from the clinical side to IT, and frankly, everywhere in between. HIPAA, of course, was set up to protect PHI from intentional and also accidental disclosure, protecting that patient's information. Compliance with HIPAA is required to avoid penalties and potential jail time for executives within companies, as well as lawsuits and civil fines. Additionally, since you're also probably dealing with protected personal information, personal identifiable information, you may be subject to fines from states on a per record basis for also losing that information or disclosing it. So you could get hit from two different angles. We talked about the challenges facing healthcare. Oh, went ahead of slide, sorry about that. With HIPAA, healthcare organizations are facing technology challenges, including the need to exchange documents electronically. There are real cost savings and the ability to automate processes when dealing with electronic documents over paper faxes. If we talk about fax specifically, the cost savings of just moving away from the fax machine to a fax server or a cloud fax service is tremendous. You remove the monthly line costs and the machine maintenance. In addition, the healthcare professional is no longer wasting time walking to and from that fax machine. This is just a simple example of what can be done. Of course, you can do a lot more sophisticated automation that has more cost savings and automation built in. Security is another important challenge. PHI must be kept secure from prying eyes, once again, whether it's intentional or accidental, which leads to the need to authenticate and store data encrypted at rest. Fax is a required part of document delivery within health organizations, as it serves as a common and simple method of sharing healthcare information, but it must be implemented in a secure and productive way. Healthcare use of fax is climbing every year, and it can be automated for productivity gains, security, and ease of use. The requirement to know what happens to healthcare information with audit trails, reporting, and recording information in the patient's record is a big challenge to meet HIPAA compliance. When it comes to storage and tracking, you need to know the who, what, where, and when of all the documents. Who had access? What did they have access to? Where did they send the document afterwards? And when did all of this happen? Some other challenges within healthcare industry revolve around the types of solutions out there and how they interact with your day-to-day business application. Any fax solution that is brought into your organization must be cost-effective, easy to use, scalable, and above all else, reliable, especially when working with private and time-sensitive information that can be found in these documents. We talked about the challenges facing healthcare, so the next step is to understand the types of documents that contain PHI that are shared and start to talk about how to protect them. So exactly what sort of documents are healthcare providers delivering or sharing? It's no surprise that the treatment of patients is accompanied by a trail of documents and paperwork and records that must be located, updated, stored, communicated to people on the outside as well as internal. Those are going to physicians, staff, payers, nurses, labs, home care facilities, and many other parties. It's amazing how many people in an organization can be involved in treating a patient. These documents can include anything from patient records to prescriptions, lab reports, to clinical notes, diagnostic information, imaging analysis, the actual image, invoices to payers, and much more. Document delivery systems are needed in virtually every aspect of healthcare, from the physician's office to inpatient and outpatient services, to the revenue cycle and the supply chain. It's important to note that these documents are being delivered both within healthcare organizations as well as external parties, such as patients, consulting physicians, insurance companies, labs, lawyers, and others. We also have to face the reality that while there's been great progress in working towards completely electronic solutions, there's still a lot of actual paper involved in healthcare. We've all seen it in ERs and doctor's office. There needs to be a way to digitize the paper and exchange it in a secure manner. One of the easiest ways is to use fax to bring the paper into internal systems and to share with the outside world. We talked about the challenges in healthcare and the types of documents that they're sharing. Let's talk a little bit about the applications that handle the documents and how fax is being used with them. Meds in a pharmacy situation, medicine prescribed by physicians and ordered from the pharmacy by fax can easily be received through the fax solution and routed to a queue to be accessed online by the pharmacist in order to fulfill the order. Orders can be viewed on the screen while information is entered into a third-party pharmacy application, or with that integration, may be brought directly into that application. All faxed orders can be easily indexed and archived. Our fax client offers workflow functionality such as robotic actions, timers, custom indexable fields, fax preview, which allows you to customize that environment to your needs and to your organization. All that and more can be done while requiring things like AD authentication and encrypting that fax data at rest. From claims and billings perspective, faxing is still one of the most ubiquitous and timely ways to communicate billing and claims information within healthcare. Biscom offers the ability to quickly turn around invoices and information requests to customers while avoiding the hassle of using costly fax machines. With our patented Add to List functionality, claims departments, as an example, can print information from disparate sources in order to build a package before sending to a patient, insurance provider, or maybe even a law firm looking into an issue. Medical records, of course, with EMR systems today, fax integration allows you to directly fax from within that EMR application to outside entities, requiring the use potentially of phone books and contacts within the app, which secures who it's sending to and helps put a little structure around it and security, and returning the status back into the patient's record. Reducing the expenses for hard copy storage and leveraging the investment in your EMR system is done by taking outside faxes that are coming in and automatically bringing them into the system, being directly sent to a physician and or into the patient record. The rules-based routing engine that we have allows for delivery of incoming faxes, such as medical records, to be delivered to any EMR or document management solution. Patient scheduling, Biscom's Enterprise workflow client features with things like OCRs used in central scheduling departments to intelligently route incoming faxes, which are scanned orders for procedures, and scanned paper documents based on content through a workflow process, where the patient record information is received and it's indexed, and then it's easily searchable later on. A user can search using a variety of different criteria: date, the time, the location, patient's name, any of the custom indexable fields you created. And then they can instantly view the images of the original fax and all the associated data. Any procedure can be found at any time at any service point without ever having to pick up the phone. In the past, what was happening was these fax orders were being stored in file cabinets to be retrieved when the patient arrives, so you can see the productivity enhancements right there by now we're putting that online and it's indexed, and within seconds you can get that record instead of minutes. Plus, an audit trail for all activity is being captured and stored within that workflow system. HIPAA has specific requirements for handling of PHI with some fax concerns that are built right in. These requirements are outlined in order to ensure that the privacy and security of the information is protected at the point of dispatch, while in transmit, and at the delivery point. So if we look at some of these requirements, secured physical fax machines. So if you still have them, and you were using them within your organization, a lot of healthcare organizations are still doing that today, you must secure it behind a locked door if it may receive PHI or send PHI via fax. But as we all know, most of the time that doesn't happen. It's just too cumbersome and too time-consuming. It takes away from patient care. This, of course, makes it one of the best reasons to move to electronic fax using cloud faxing or fax servers. Electronic fax removes the need for securing the physical machine and relies on your network security that you already have set up. You have to make sure only authorized personnel have access to PHI. Once a fax is brought into the online world, it will need to be protected by authorizing necessary medical personnel to only have access to the fax. This can be done by using Active Directory authentication, application security, and or the application security within the EMR. It's really going to depend on where you deliver that fax to in the end. Notification and verification must be done for each fax. You need to verify that faxes are delivered to the intended recipient, both transmit and receive faxes, with notifications not just going to a general point, but going back into the patient record. Cover pages need to be included so that you have the addressing information of who this fax is intended to go to and who the sender is. They also need to include disclaimers that warn that the message was intended for a specific recipient, and if you got this fax in error, please notify the sender and destroy the fax. Secure locations received need to be set up. When receiving faxes, they must be secured. First with authentication, as we spoke about, and with protecting the fax at rest using encryption. You need to maintain transmit and receive transmission records and transaction log summaries to help identify what happened to a fax. These are all components of quality of care as well as HIPAA. Now that we've covered some of the challenges of healthcare organizations and what they're facing, let's talk about some of the things to consider as you move forward with an enterprise fax deployment or a fax deployment, be it cloud fax or premise fax or a hybrid solution. As you look at our current environment, or your current environment, I should say, and possibly considering something new, the first thing you really need to think about is volume. How many faxes are you sending in and out? What are you currently doing? What are the trends that you're seeing for the future within your fax data? You may want to consider a hybrid solution that will allow you to grow ports, create high availability, or a disaster recovery plan. Or you may want to have only a premise solution. Or you may want to take it all to the cloud using a cloud faxing solution. You will need to research all the ways that your departments are currently faxing, what type of documents they're faxing, as well as the volumes and any likely projected volumes from each of those different departments for the future. I admit that's a very difficult thing to do because a lot of times fax can be unmanaged within healthcare organizations, especially hospitals, and it's a little difficult to gather all that information, but if you get that up front, that'll help you going forward. You want to consider security, not just your own, but those of your customers and partners. Find out what regulations are involved. Of course, we're talking about HIPAA here and healthcare, but you also may be handling personal identifiable information. You might be handling credit card data. So state privacy laws may come into play. PCI regulations may come into play. You want to consider, does your current solution or any solution you're looking at take into account these other regulatory compliances? Once again, you need to understand how the data needs to be secured and authenticated based on each of these standards that you may be subject to. Do you need to integrate with your mission-critical business applications into your faxing environment? So these are your EMRs, your imaging applications. Would your organization benefit from advanced features such as the ability to route faxes based on barcode or OCR or advanced rules? Will automation benefit your environment? Take time to understand all the functionality you need today by talking to those business groups, but also try to anticipate what they may need in the future. You don't want to buy a product today, deploy a product, use an online service. They may limit you down the road in the future, a few months after implementation or even years. You want to make sure you can take everything into consideration. You must also consider how easily and efficiently your fax solution can be managed and how well that solution provider stands behind the product with support. Are you using a provider that founded the industry and is dedicated to providing the best offering possible? Let's talk a little about HIPAA and Biscom and faxing requirements and how that all works to communicating patient data with considerations. The U.S. Department of Health and Human Services accepts fax as a method of delivering patient data to the outside entities. When it comes to fax and HIPAA, the main concern is protecting the transmission of data and the data at rest. In a traditional fax machine environment, as we've kind of talked about, organizations need to secure that data in that physical fax machine and that paper that's also associated. There's a better way to provide both quicker access to the data while reducing the risk and ensuring compliance. And of course, the good thing is these institutions that we've worked with deployed our solutions of production fax in order to provide easy and secure access to faxes by their healthcare workers, eliminating not only wasted time, but the risk of accidental exposure of the data. You just need to secure it within your network, make it easier for healthcare personnel to provide a high quality of care by providing that fax to healthcare professionals on their desktop and mobile devices and not at the machine, and leverage your existing network security to help protect it. Securing a fax is done by delivering the fax directly using automation to the healthcare worker's desktop and applications without human intervention. That's one of the best parts. You can reduce some human intervention and personnel take them instead of working on processing of documents, bringing it more into patient care. APIs and workflow tools are used to deliver faxes to an application like EMR. OCR text tag extraction and or barcode reading can also be used to populate columns and determine the final destination of these documents. When using the Biscom fax web or desktop client, you can secure the fax by using AD authentication, encryption at rest, so you can be assured that the patient record is protected. You also have the ability to audit the user's actions. When it was deleted, who marked it up, who deleted it, when it was forwarded, who was it forwarded to, and to provide those reports on the who, what, when, and where of each fax transmission. Those requirements that we talked a little bit about for disclaimers can be automatically enforced, and they're accomplished by enforcing the use of specific cover pages through policy, and then just embed that disclaimer on that cover page file. It's quick and easy to set up with no chance that the disclaimer is being forgotten or the cover page being left off the transmission. Additionally, secure file transfer can be used to deliver fax and patient data to endpoints internal that require an even higher level of security or outside your organization. Maybe it's a local lab that you work with all the time. Biscom secure file transfer software is used to share documents, including faxes internally and externally, with secure and easy-to-use methods while using encryption at rest. Finally, the most important factor is to partner with a vendor that has experience working with healthcare organizations to help solve HIPAA compliance challenges. So we integrate with a lot of different applications, just a handful on the screen right now that we have. We do integrate with more than what we're showing here. User can send and receive faxes directly from these applications. In case of Epic and Centricity, it's working within those EMR applications to send and receive things like prescriptions, patient data, receiving the fax into those systems through a document management system, be it OnBase, Index Logic, Cryptix, DocuTrack, as well as integrations with things like MySys CPR and Laboratory to conveniently fax out data from these applications. Siemens Novus radiology solution, enabling staff to streamline radiology registration, scheduling, and patient tracking, being able to automatically fax from the Biscom system into these environments. Biscom has enhanced its traditional fax technology specifically to help organizations meet the stringent legislation-mandated requirements for controlling the dissemination of PHI. Biscom offers organizations with our fax service as well as cloud faxing services the means to enhance the security of their fax network and thus strengthen the security compliance efforts by using either or both of the following options. Integration with our secure file transfer technology, as I was just mentioning, using the Biscom secure file transfer software to deliver that fax in a totally auditable as well as method internally as well as externally. Or it's using the Biscom mailbox server component, which allows for the encryption at rest, finer security granularity, as well as more automation. In addition to the design of the Biscom fax server solutions, helping achieve HIPAA compliance, are the best practice safeguards Biscom has put in place to secure its information and facilities for those customers using the cloud fax service. Users who access Biscom's cloud fax service can be assured that the best practices are in place, from data encryption, internal system security, facility security, security management, and much more. Biscom faxing solutions are available in the cloud, premise, or hybrid to meet every customer's needs. Our cloud solution is based on our own fax service, a full-featured enterprise fax solution, and it's bundled as a cloud offering. Unlike any other cloud fax provider, you get all the functionality of a fax server, including granular user and departmental control, reporting, and web and mobile interfaces. The Biscom fax server is a workhorse solution for organizations of all sizes with production-level faxing, where reliability and scalability really matter. The hybrid solution is the most powerful combination of an on-premise fax server integrated with your cloud faxing service for high availability, redundancy, and seamless transitions. No retraining is needed since the hybrid solution provides a single, consistent end-user and administrative interface. Companies use hybrid faxing for DR, for failover to the cloud, peak overflow, as well as broadcast faxing. Integration with directory services, including Active Directory and other LDAP-compliant directory services, is done by the solution as well. Group policy and FAXCOM policies are used to control the user's faxing environment. There are numerous clients available, as you can see, for users and applications, including a web, desktop, mobile, Outlook clients. These mobile clients are available for both the Android and iOS devices, phones, and tablets. The web and desktop clients have the ability to send and receive faxes with the options for workflow capability and broadcast functionality. Our advanced fax routing is a rules-based engine that are used to deliver inbound faxes to a variety of destinations while allowing for the automation of the workflow. It works by setting a condition and then taking an action on that condition. It could be as simple as routing based on time of day, or complex as reading a barcode while doing an ODBC lookup and delivering to email. APIs are used to integrate with faxing with other applications and processes with web services. Our web services API is by far the most popular being deployed by customers, but we have many different APIs that also fit your needs. Latest innovation in fax options and redundant fax options and security is the hybrid fax. This allows for the best of both worlds in fax servers and cloud fax by allowing for failover and overflow. There are two main ways that our customers use it. Using a fax service as a failover, where the queue component of our software moves faxes to the cloud based on the conditions, or for overflow for large broadcasts of faxes. You can fail over to the cloud when your local fax server is offline for maintenance or hardware failure, or failover can be executed based on a time delay that is definable by you to meet your business needs. Reporting module gathers a lot of information for you, which will help you with compliance. And by gathering all this information, it allows for extensive reporting. The reporting web client that we provide has numerous standard reports, while also giving you the ability to customize reports for your own needs, as well as writing your own queries and gathering the information if that is easier and more preferable for you. You can also schedule reports to be delivered on a regular basis to provide information to users while only having to set them up once. As an example, you could set up a department to receive a delivery every Monday morning at 8 a.m. to let them know how their departmental usage was the week before. Additionally, reporting in our dashboard option can be used to alert and alarm based on conditions happening in the system, so it gives you a full-featured management alerting system to let you know what is going on with your faxing ecosystem. Direct integration with our file transfer solution, as we talked about, along with the delivery inbound faxes using SFT, is built in, but that also allows you to quickly and securely send the faxes, but at the same time, it gives you an audit trail where you can see who accessed the fax, if it was forwarded out to the outside the organization, if it was deleted, who did it, and who saw it. So both of those options, delivering to the main system as well as the SFT, has an audit trail that you can use. Biscom has been working with healthcare companies to automate faxing for 30 years. We continue to support and work with the largest healthcare companies around the country and the world. Our customers include small and large hospitals, small doctors' offices, regional doctors' offices, pharmaceutical companies, equipment vendors, imaging labs, health plans, diagnostic labs, and many, many more organizations and industries. Biscom products support healthcare organizations with meaningful use while also assisting healthcare organizations with HIPAA compliance. We do this by providing the products that give customers the ability to ensure their adherence to these requirements while also having expertise on our staff. Our product profile ranges from fax service to cloud fax, secure file transfer, and file sync and sharing solutions. All these products are designed to help you exchange PHI while meeting standards. Biscom's customer service approach is recognized as the best in the industry. Our sales, support, professional service, and developers actually work with each other in partnership with our customers. We pride ourselves in providing unmatched world-class customer service to our customers and prospects. Now let's move on to Q&A. We have some questions coming in. I'm going to take a second here and just pull any of them up. Okay, so the first question that we have, do you have the ability to monitor the system in real time and understand what's going on? And the easy answer is yes. That is our dashboard part of the solution, where you can see how many ports are busy, what is going on, how many faxes are being sent, as well as it gives you the ability to do some alerting and some alarming based on it. Another question here coming in. Can I split faxes that contain multiple lab results that are being received from my vendors? Simple answer is yes. You could do a split on all pages. You could split based on some condition changing. Maybe you have a barcode on there, and the barcode changes when the patient changes. Maybe it's a word that we're OCRing that we see, it says Form 87-2. We see that, we split the page, we can do that as well. Another question, do you support faxing from multi-function devices and multi-function printers? Yes, we support it from really any multi-function device that has email or does SMTP, because you can email it to yourself, scan it to your desktop, send it out directly from there. Or we have integration with lots of different products, HP, Kyocera, Xerox, Ricoh, Samsung, and others, where you can send directly from the device and send it out. That's really a preference thing. I know personally I like to scan it to my desktop so I have a record of it there before sending it out, but I know a lot of people, they have that paper fax and they just want to send it out and they want to know that at least it's going through the faxing solution. Another question, can I define the different roles within my organization for users? The answer is yes. So especially with our mailbox server, you can define who has access to which mailboxes. You could even have supervisory roles where you could have a nurse manager, as an example, monitoring 5 different mailboxes to make sure that faxes are being processed properly and being acted upon. We have that with one of our payers that we work with, payer organizations, and they're making sure that when faxes come in, they're being processed within a set amount of time that is required by law. So that way they don't get fined and they don't have to perform a procedure that they don't believe is needed. So can I use your system, next question, to read barcodes off a fax, specifically the patient record number embedded in the barcode? And I want to route based on that record number. The answer is yes. So we can read barcodes off faxes. You can then take that information, do a lookup in an ODBC database, and then deliver it to a location based on that. Or maybe you're not even delivering it to location. Maybe you're just marking the fax with that medical record number. We're extracting it, populating an indexable field, a custom field that you may have created. Another question on fax broadcasting here. Do we do a monthly fax broadcast or a fax blast, as you say, to all of our providers? Can I shift that traffic to the cloud? The answer is yes. You can send, you can choose where to send it from. You can send all that traffic through our cloud offering. And you could also do the reverse if you wanted to. Maybe you want your fax broadcasting locally and your regular faxing over the cloud, or you might want to do it all in the cloud. This question on, we offer faxing as a central service within the hospital. How do I do bill back? That is a good question. That's one of the biggest things that a lot of our customers will deal with, which is how to charge the end user of the fax, whether it's received or transmit, for their share of the service. You can use our reporting module to do reports to understand how many pages each department send and receive. You could automatically send those reports out, as well as just build a central report for it. Do you offer APIs? The answer is yes. Just briefly touched on it today. Our web services APIs are most popular. We have COM-based APIs, we have file APIs. A lot of different ways for you to work with us with APIs. Most people are going to use web services these days, but some legacy systems requiring that you use, say, COM, and we still have that and offer it. And the final question I see here, at least coming in right now, and I'll take one more check. Do you offer professional services to help with deployment, workflow setup, and any configuration? The short answer is yes. So we offer all those services and more. We've done assessments. We've gone on site and helped you identify the best way to use fax, whether it's ours, cloud or premise server, or a combination of both. Hybrid might be the best option. So there's those things that you can learn about through one of our professional services. We can help you do the deployment, whether that's remote or on-site. We've done both. You didn't ask about it here, but training services, both online and on-site, as well as in our corporate facilities. We do training all the time for customers, and both end-user training from a train-the-trainer perspective, as well as administrative training. So it looks like that's the last question we have. If I did miss any questions, I apologize, and we'll get those answers out to you. I want to thank you for taking time out of your busy day today. I know all of you have a lot of things that you got to get done during the work day, and we really appreciate you taking the time out to spend with us on this webinar, and we hope to see you next time. Have a good afternoon.